Hello, my name is William Kidden Cunningham, and today I will be showing off my body system. So for this, I got the muscular system, which I will begin presenting. The muscular system. The muscular system consists of three types of muscle: the skeletal, cardiac, and smooth muscles. Each composed of their own respective attributes and uses. Skeletal muscle is striated and made up out of muscle fibers. These muscle fibers are made up out of myofibrils, which are rod-like organelles, which I have included here. I may be pronouncing that wrong as well. Those are in turn are made up out of sarcomeres, which are the smallest functional unit of striated muscle. Cardiac muscles are also striated, but are distinct because the fibers are laterally connected as opposed to skeletal muscle. These muscles are involuntarily contracted and are controlled by the sinus node, which is influenced by the nervous system. The third muscle group is the smooth muscle group. Once again, the smooth muscles are involuntarily contracted. This muscle group is able to adapt to different levels of stretching and moving around, which is needed and used in regulating proper blood flow and moving substances through our digestive system. The normal function of our body system, body system. Each of these muscles have their own distinct job, but as a collective whole, these muscles provide strength, balance, posture, movement, and heat for the body to keep warm. The skeletal muscle group is in control of contractions to produce movement and heat for the body to keep it warm. The skeletal muscle group is in control of the cardiac muscle group is responsible for contracting and pumping the heart. And finally, the smooth muscle group is used to move food around inside of your body. Risk factors for developing problems in this system. Risk factors involved with developing problems within the muscular system can include fatigue, aches and pain, weakness, stiffness of muscles, discomfort, tenderness, numbness, burning, tingling, swelling, loss of strength, loss of joint movement, or trouble sleeping due to the pain. All of which are uncomfortable and not desired for proper body function. Alongside with all these problems is the ability for the problem to worsen and progress into more severe conditions. Age-related changes of this system. Like many things, age affects how this system functions and can operate. With age, our muscles lose size and strength as we get older. This can contribute to fatigue and weakness. This also contributes to the lack of being able to do things on our own or dependency on others. Common disorders of this system. A few, to start, we'll go with muscular dystrophy, which is a group of genetic diseases that causes progressive weakness and degeneration of skeletal muscles. This disease affects between 19.8 and 25.1 per 100,000 persons years globally. There is no cure, although steroid treatment can be used to slow the deterioration of muscles. Strain is another one, which is an injury to the muscle when it is stretched too far. This can include pain, swelling, muscle spasms, and limited ability to move the muscle. Some ways to fix it are with rest, ice, compression, and elevation. Tetanus, a bacterial infection, which can be obtained in many ways, including cutting your skin with metal or getting bit by a cat. Tetanus can cause very painful muscle contractions, particularly in the neck and jaw. It can interfere with the ability to breathe, and that would eventually cause death. There is no cure, although there are vaccinations to help prevent it. And finally, some important information needed for a nursing assistant to know and care for a person with disorders with this. Considerations for parents with musculoskeletal conditions include their specific diagnosis, pain levels, physical limitations, medical history, lifestyle, and potential impact on daily activities. All of which can greatly impact how you are to care for the patient or go about treating them. Overall, this is just a little bit about the muscular system. Here are some pictures. Tetanus along with muscular dystrophy, just some little things here and there, and then this is the muscular system as a whole. And that concludes my presentation. Thank you for watching.